Welcome to our Facebook Live, where UC Davis health experts provide information that you want to know. I'm Pamela Wu, and with me today from our world-renowned Mind Institute is Dr. David Amaral and PhD candidate and graduate researcher Einat Waizbard-Bartov. Today we're going to be discussing autism in children and some of the latest research related to autism in kids. This includes my guest's latest published study on how autism severity can change substantially during early childhood. If you have questions today, you can post them in the comments and we'll do our best to answer them toward the end of the discussion. Dr. Amaral and Einat, thanks for being with us this morning.
Thank you.
Happy to do it, Pamela.
So glad that you're with us. Einat, let's begin with you and some background on this. What are some of the early symptoms of autism in children?
So in children, a lot of times we'll see children not sharing things that they're interested or excited about with their parents, like seeing a plane going by in the sky. We'll see them not being interested in interacting or playing with kids their age. They might not answer when their name is called or use body gestures to communicate, like pointing to things that they're interested in. And we'll also see repetitive behaviors. So when they're playing, instead of like playing with toy cars, we'll see them lining them up instead of freely playing with them. These are just some examples of symptoms in early childhood.
Mm-hmm.
Dr. Amaral, your latest research indicates that the severity of autism symptoms can change between 3 and 6 years of age. And by the way, we will put a link to that paper in the comments so folks can take a look at it.
Mm-hmm.
How would you summarize what you found?
Right. So, Pamela, this is a study that is one of many studies that have come out of what we call the Autism Phenome Project. That project started at the Mind Institute in 2006. And the goal of the project is to bring children into the Mind Institute just after they've had their diagnosis, and then literally follow them through life to see how their autism changes over time. We also carry out magnetic resonance imaging of their brains so we can see how their brain is developing over time. And so in this study, we examined the level of symptom severity when they were 3, when they first came into the study, and then 3 years later when they were about 6. And we use something that's the gold standard of how you diagnose autism. It's called the ADOS for short, or Autism Diagnostic Observation Scale. And what it measures is the ability of a child to interact socially. The less a child interacts socially, we would say the more severe their autism is. And as Einat said, the other characteristic is repetitive behaviors. And the more repetitive behaviors they do, which doesn't allow them to do more productive things, the more severely affected we say they are. And so what our study did is to compare the level of symptom severity when the child was 6 compared to when they were first diagnosed at 3. And what we found was that about 50% of the children had the same level of severity at the 2 different time points. But what was different from what is generally thought of in the field is that 50% of the kids actually changed pretty substantially over those 3-year period. About almost 30% of the children decreased in severity significantly, what would be a clinically meaningful decrease in their severity. And on the other hand, about 18% increased in severity over that time period. One of the interesting facts that we were able to evaluate, because our study includes a higher percentage of girls with autism. Girls have unfortunately been understudied historically in autism research, but we have recruited a higher number of girls into this study. And what we found was that girls tended to show greater decreases in severity than boys, and less increases than boys, so that we actually did see a difference depending on whether you were a girl or a boy.
Can't recall if you mentioned this, but how many children were involved in the study?
Right, I should have mentioned that. There were 125 children with autism, which is a fairly large number compared to most studies in the literature.
And how would you describe the potential significance of these findings?
Yeah, well, there's lots of things. First of all, I think we're trying to better chart the lifespan of people who have autism to understand, what is the potential for change, or what is the potential for change over time. I think historically, I think people viewed autism as once you received a diagnosis at 3, pretty much for the rest of your life, you're going to have that level of diagnosis or that level of severity. What our findings show, and other papers as well that are coming out recently, show that there's a lot more dynamism in autism in terms of the symptom severity. And to my mind, that means that there's more potential for reducing the debilitating impairments that are associated with autism. We just need to figure out how to do that better. One of the issues that we looked at was whether the kids who did better were getting more intervention than the kids who did worse. And it turns out that wasn't the case. All of the kids were essentially getting the same level of pretty intensive intervention starting when they were about 3, but we couldn't find a relationship between the intensity of their intervention and whether they did better. So that means there must be something else that determines who's going to do good and who's not going to do so good over those first early 3 years of life. And one of the things for our research effort is now to try and figure out, can we come up with a biomarker, some kind of indication that when the child is 3, that indicates this is a child that's going to do well and we want to promote that, but maybe this is a child who's not aiming at doing so well and we need to do something more, something different than what they're doing in order to try and give them the best quality of life.
Wow, that is really fascinating. Einat, the paper refers to kids improving as you were observing them. What does that mean? What does improvement look like?
Well, when we say improvement, we mean that as kids decreased in the severity of their autism symptoms, they became more socially engaged with others. And the level of repetitive behaviors that they were doing was decreasing. So they were less occupied with that. And we also found that this group of kids who decreased in symptoms, they were also gaining in IQ and in adaptive functioning. So when we're looking at them, we see that in parallel to the symptoms being less prevalent in their behavior, they're gaining in cognitive ability and in functioning in areas like communication and their independent skills, their daily living skills. So when you look at all that as a whole, you see that the kids are generally improving across early childhood.
I'll invite both of you, either of you, to weigh in on this next issue, and that is that more boys than girls are diagnosed with autism. Is this because girls' diagnoses are being missed or the diagnosis is delayed? Because I know that you looked at this in your paper.
Yeah, well, maybe I can start and then Einat can weigh in as well. But so this reason of the question of why more boys get diagnosed than girls is really a complicated issue. And I think there's not a single reason, there's multiple reasons, and probably the reasons that we haven't figured out yet. So I think on one level, there are biological differences in girls and boys, obviously. And for a long time, people have talked about the fact that girls have a protective effect. And what I mean by that is that even if you look at the genetic causes of autism, it turns out when you look, so we have lots and lots of genes, and it turns out it's rare that just changing one gene is going to cause autism. You have to change multiple genes. And it turns out when you look at big populations of boys and girls, the number of genes you have to change to get autism in a boy is fewer than you have to change in a girl. So in a sense, a girl needs a bigger genetic hit or more genetic change in order to show autism. So the other way to think about that is if a girl has, or if a boy needs 5 genes to be altered to develop autism, if a girl has 5 genes, those same 5 genes, then she's not going to show autism. She needs to have 10 genes damaged in order to show autism. So there does seem to be some biological causes to the disparity in the number of girls and boys. And this isn't so strange because we know that there are other diseases, disorders that affect boys or girls more. So for example, more men have Parkinson's disease, which is a neurological disorder, than women. More women have osteoarthritis than men. So there are differences in susceptibility, and we think that this is the case for autism as well. But then there's another layer where things haven't been so well explored, and that is that maybe girls with autism, for a variety of reasons, are hiding their autism. And so, as you said, they're not being detected, or they're being detected later. And, why would girls be better able to hide their autism? Einat has some thoughts about that.
Okay. And also I wanted to add that when we assess autism, we're using measurement tools, which have been developed for a long time based on autism research. And like David said, traditionally, autism research usually involves samples of boys, a lot more than girls. So these tools for assessing symptom and symptom severity and giving diagnosis, they're based on what we know about autism in boys. And the symptoms in girls, when girls do have autism, their symptoms might be different, either less obvious or of a different quality than the symptoms of boys. So if we're using the tools that we have, it might very well mean that we're diagnosing less girls, or at a later age, or just missing them. So like David said, it's a complex it's a complex set of reasons for what's happening with girls.
One of the things, Pamela, that happens is, boys and girls are raised differently. Moms and dads treat little boys differently than they treat little girls. Maybe that's not happening so much anymore, but it historically has happened. And so I think that there's more of an attempt on parents to be more emotional and being more social with little girls than with little boys. And in a sense, there's an expectation for girls to be more social and engaged than little boys. And so one thought that we have, and certainly we haven't proved this, is that just the way boys and girls are raised might actually be giving more intervention, in a sense, parental intervention to little girls than to little boys. A lot of what intervention is in autism is trying to get children to engage socially. And if that's the expectation for girls more than boys naturally, they're going to be getting more parental intervention. The other thing too is that I think even young girls, but certainly this is the case for older girls and women, have sort of a heightened social understanding of social interactions and social expectations. And so one of the other things that we talked about in the paper, and again, this is a hot topic now in autism research, I think there needs to be more foundation to it. But that is that women and maybe girls as young as the girls in our study don't necessarily lose their autism, but they're able to mask it, or the buzzword is camouflage it. And so it's like more and more women who have autism are saying, I'm no less autistic, but I know I'm not supposed to act like a person with autism, so I camouflage it. And maybe part of what we're seeing in terms of the decrease in symptoms, which again are only judged by this one test in a relatively short period of time, is that girls know what are expected of them better than boys, that they do it.
That is absolutely fascinating. It's such a testament too to certain gender stereotypes, and as you said, how we raise our children. That it's
Yeah.
some folks feel it's okay for boys to be more stoic.
That's right. That's right. Exactly. Yeah. Yeah.
We are discussing the latest research on autism in kids. Our guests today from our world-renowned Mind Institute are Dr. David Amaral and PhD candidate and graduate researcher Einat Waizbard-Bartov. If you have any questions, please feel free to post them in the comments, and we'll do our best to get to them before the end of our discussion. Dr. Amaral, in the study that you did with Einat, you do mention camouflaging. You just said that's sort of the key word here, hiding as a strategy to mask symptoms. For those who don't know, what kind of camouflaging does this refer to, and why do kids feel obligated to do this? Einat, let's begin with you.
So people with autism might camouflage or mask their symptoms in order to appear more neurotypical, because showing autism or showing autism symptoms might be perceived as being different. And being different has many strengths, but it also presents challenges at any age, I think, but especially also for children. The problem with camouflage is that it's been shown to come at a cost to the individual. So camouflage is a process that a person needs to be constantly in control of the way they present themselves, of their behavior. And it takes a lot of resources out of a person. So it's been shown that people who camouflage across extended periods of time pay a toll in mental health. And camouflage has been associated with heightened anxiety levels across time. So people with autism, they talk about it as burnout. They do this for extended periods of time, but after a while, it takes a toll on them. And that's why, you know, these things, they have their advantages and their disadvantages. And it's a complex issue. I think that's why it's a buzz too.
Well, it seems like it would certainly take a lot of energy to recognize that your behavior is different and then sort of work hard to present something different to get around it. Can you give some examples of camouflaging or masking behaviors or what that looks like?
Yeah. Do you want to do that, Einat? Go ahead.
So camouflaging could be in little girls, for instance. There's a study from UCLA that shows how girls might understand that they're supposed to play with others, but if they don't actually want to engage in it, they'll play like on the periphery of the group, of the social group. So they won't actually appear being alone on the side, but they're not really engaged in the game that everyone is engaged in. So that's just one example. And when you look at it from the sidelines, when you're looking for it, you can start seeing it in girls' behavior. Or maybe in a conversation, you know that you're expected to ask something about the other person. So cognitively, you're aware of it, so you do it in an effortful, deliberate way, not because of just the inclination that you have in a conversation to follow up on what the person was saying. Those are just a couple of examples.
And I think that there's sort of two levels of interest here in this whole topic. One is that at this point, other than examining the behavior of the person, like we did in using the ADOS, it's really hard to tell what level of autism a person has. It's not like you can ask, you know, does this person have an infection? And you can look at the bacteria and say, okay, it's this level, and then all of a sudden it goes down to this level. So you've reduced your level of infection. How do we say somebody really has changed their level of autism? And so Einat and I and others are trying to figure out other ways where we can look at brain function and determine whether there is a biological marker of autism. And from a research perspective, I think that's interesting because we really are trying to understand the biology of autism, which is a function of how the brain is working. On the other hand, there's a sociological issue here, and that is that that what our expectations are. And I think there, the feedback that we saw online to this article from people with autism is that it was sort of like, duh, we've been experiencing this, and yes, we're hiding our autism, and if you read, there was an online website that had literally thousands of responses to the article, and many of those responses were yes, and it was not only females that mask. I mean, it's males with autism as well that know that in order to fit into society, they have to act in a certain way. They have to act in a certain non-autistic way to really fit in, and it really comes at a cost, that people are stressed out, as everything that Einat said, that they're anxious. There's more psychopathology, and the real downside is that we know even serious psychopathology and even things like the prevalence of suicide is much higher in people with autism than typically developing people of the same age. And so I think, in a sense, while we are investigating these symptoms, the underlying message is that if society could be more accepting of the behavior of people with autism and the perspectives of people with autism, then at least it could bring down the stress level, and we could all work together. And that's a message. Sometimes these words, even when we use the idea of autism severity, it's like, something's bad about autism. And, we're all about trying to improve the quality of life of people. We want to decrease disability, and the kinds of things that we're measuring are things like repetitive behaviors or lack of social interest that I think, society generally speaking thinks gets in the way of quality of life. And those are the kinds of things we'd like to understand and help eliminate. But we're not about eliminating autism per se. So I wanted to make that clear. And I think it's an important issue that is getting more and more credibility, in the field of autism research.
Yes, that these are merely differences.
Yeah.
You mentioned something really interesting there, that that you can't measure this the same way that you measure an infection per se, and sort of like quantify the difference, because so much of the assessment is sort of observational. So that sort of raises the question whether kids are actually getting better or getting better at masking their symptoms. Yeah. Dr. Amaral, do you want to talk about that?
So this is something that we were really concerned about when we did this study. And so first of all, you have to know that the people who do the ADOS are trained psychologists usually, and they've achieved, we call it research reliability. That means they've gone through extensive training. They've worked with somebody who is an expert on this measure, and they basically graduate at some point to being regarded as somebody who can do this reliably. And we're fortunate at the Mind Institute that people who were with us at the beginning of the Autism Phenome Project, psychologist Leslie Dupre, for example, are still leading the clinical core at the Mind Institute. So they've been with us for the entire project and have been able to guide all of these assessors. So I think it's really, we've done everything we can to make sure that we are reliable and we're getting accurate data, both that when the child is 3 and when the child is 6 and beyond. Actually, these children that are the basis for this study have come back already when they were 11 or 12. So we have another data point that Einat is analyzing at this point, and we're gearing up for them to come back as teenagers, as 15-year-olds. So we've seen these children from 2 all the way up to when they're teenagers. And, again, we've tried to make sure that when we measure this, it's reliable. It's the best thing that we can do at this point in time. But, I think there is on the horizon some other strategies like looking at how people visualize images on a screen. So I'm looking at your face now and I'm paying attention to your eyes, which is a typical thing to do. Individuals with autism tend not to. They'll tend to look off to the side and not make a lot of eye contact. Well, there are new strategies where you don't really have to instruct people at all. You just have them look at a screen and show them various social situations, and that's gives you a measure of the severity of how their, or the level of which their brain is functioning in a different way from a neurotypical person. So those things are on the horizon. We, I keep saying in just a few years, and I've been saying that for the last 10 years, but in just a few years, I think we'll be having some more of these biologically oriented markers that, will go hand in hand with the behavioral assessment. I mean, it won't replace them, but it will allow you to confirm using different strategies.
Einat, can you please explain what you found about the relation of IQ measures to changes in symptom severity?
Yeah, so in the study, we looked at autism symptoms and other variables, developmental characteristics of these kids to try and understand if relationships exist. And what we found was that the kids who decreased in their autism severity, they had higher IQs initially at age 3 compared to the other kids in the sample, and they made gains across early childhood in their IQ. And in contrast, we found that the kids who increased in their symptom severity had lower IQs, and they were the only group of kids in the study who did not make IQ gains across early childhood. So looking at these findings, we do think that there's a relationship happening between IQ and symptom severity change across early childhood. And that's something that we're continuing to explore now with, like David said, with another time point into middle childhood.
What would you consider to be the takeaway for concerned parents, for parents who, maybe have read your study or just sort of trying to make heads or tails of it? What advice would you have? And I'll invite both of you to weigh in.
Yeah. Well, so when we started the Mind Institute, now more than 20 years ago, we were started by parents who have children with autism. And when their children were diagnosed, every single one of them, the parents were told basically by clinicians at that point in time, your child has autism, you might as well even consider institutionalizing them or find them a place to live because they're not going to change. They're just going to have autism for the rest of their lives. When we started this study, it was motivated by work that's done at the University of Connecticut by a colleague, Deborah Fine. And she published a couple of papers saying that some kids with autism ultimately have what she called optimal outcome. And what that means is that they go from having a diagnosis of autism, a clear diagnosis of autism, to at some point in early childhood to not qualifying any longer for a diagnosis of autism. Their behaviors had changed so much that they appeared to be more neurotypical than autistic at that point in time. And really, we've looked at that in the Autism Phenome Project, and there are kids that have achieved optimal outcome. It's about 5% of the kids in our Autism Phenome Project. But what we realized, and Einat realized, was that beyond just having a change in diagnosis, is that there really is a lot of change in the severity, as we talked about, of autism symptoms. And what that means is that between 3 and 6 years of life, a lot of kids, at least around 30% of the kids, were engaging more in social behavior or having less repetitive behaviors. So living a life that was more involved with their family and able to go to school and things like that. So I think what this study suggests is that 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 family that has a child diagnosed with autism doesn't necessarily have to be pessimistic. They can be optimistic that their child can actually do well, and that we're working hard to try and figure out, number one, what are the markers that let us, I would love to be able, when a child is diagnosed, to be able to say, okay, your child fits into this category and here's what you need to do to optimize their growth. And your child, or alternatively, we know that your child is going to have some really strong challenges, and here are some other things that you can do to overcome those challenges with your child. But we can give them advice about how their child is going to turn out if they proceed. We're not there yet, but what we see from this study is that there are infinite possibilities for what can happen when you have a diagnosis with autism. So I take this as a very hopeful study showing that there is potential for positive change.
Einat, what do you want parents to know?
I agree with David. I think that what we found here is that, to our surprise, things are much more dynamic than we thought they are. Children can reduce in their symptoms, in the severity of their symptoms at early ages, even from very high initial severity levels at an early age, at age 3, which is a really encouraging thing to know. And I think it gives also a lot of motivation to professionals, to clinicians working with kids, that we can see results. And on the other hand, we see that there's a group of kids who started off with fairly low severity levels, but they increased over time. They increased across early childhood. So that should also be a reminder, I think, that children need their intervention. Children need as much support as they can get, regardless of what they appear, what their symptoms appear to be at an early age. And that generally things are more dynamic than we thought. I think that's the take-home message.
I just checked for audience questions. It seems that we don't have any at this time, so I'll invite both of you to make any closing comments before we go.
I appreciate the opportunity to talk about this paper. The paper is freely available, and the link to the paper will be provided, and people can download it and read it in its entirety. So I would welcome people to take a look.
Yeah, I agree with that. I think the best thing for us is just for people to read the paper, to see the work, and write to us and give us your comments and your thoughts about it.
And I maybe can say one more thing, Pamela, and that is that, with the COVID crisis, research at the Mind Institute has slowed down considerably. We want to make sure that our participants and families who come to the Mind Institute for research are safe, and so we won't do anything that would jeopardize their safety. But we're hopeful that things will start ramping up in the late summer and early fall. And we are recruiting. We have, beyond the Autism Phenome Project, we have what's called the Autism Center of Excellence. It's a effort that was funded by the National Institute of Health, and we will be recruiting young children into that study, essentially to do almost exactly what is being done through the Autism Phenome Project. And we will be recruiting kids who are just diagnosed in the late summer and fall to come join us and to participate in our research program. This is only one of many research programs, so I would encourage families to check our website to look for research that they find interesting and compatible with their family situation, and then when it's safe, to join us in our research efforts.
Thank you very much, Dr. Amaral and Einat, for being with us today. We very much appreciate your time and the great advice that you've shared with our audience.
Thank you, Pamela.
Thank you.
And thank you for joining us for this UC Davis Health Facebook Live. If you have more questions, please post them in the comments. We will get your questions to our experts so they can continue to be answered. And we encourage you to share this post if you have family and friends who would enjoy learning from it. For up-to-date information on what's going on at the Mind Institute, go ahead and head to health.ucdavis.edu/Mind Institute. Thank you for joining us.